So, what's the latest? Where can I go? What's the eligibility? How many doses you got? 3 kinds of vaccines. We'll be back in 10 minutes when you stop talking.
Well, the eligibility is expanded down to age 16 with underlying conditions, and there's a long list of underlying conditions: diabetes, obesity, smoking, even overweight, and of course cancer, immune suppression, chronic kidney disease, chronic liver disease. It's an extensive list, and many people qualify now.
Excuse me, John. What is the, I don't want to say youngest because it might not be so young, what is the age at which you can get any of the 3 vaccines without any comorbidities at all?
That's still age 65 and older.
65, okay.
Let me ask you something, Doc. I'm hearing from a lot of people, I know you probably hear it too, that people that say, oh, just tell them you're a smoker. Or just tell them you have hypertension. That's going on your medical record if you say that, right?
No, I mean, we're not putting anything in your medical record. We are documenting that. You do have to attest that you honestly have one of those conditions, but you don't have to provide proof of it. It's too challenging, and the goal here is get vaccine out to save lives. So I want people to be honest and truthful about whether they have the risk factors or potential risk factors that are listed, and many people do. Okay,
I've had women say, to prove I'm obese, are they going to make me get on a scale? I can testify you didn't do that.
Nope, not doing that. Not going there.
Okay, how big a crowd? How many lines you going to have running at the fairgrounds? I know a lot of people now eligible. You got a big staff out there.
Right. So we have 4 tents now. Yesterday we ran 3 tents, but the wait time yesterday was less than 20 minutes all day long. We were a little disappointed. More folks didn't come and get vaccinated. We did less than 1,000 yesterday.
Excuse me, John. Pardon me just a second, because you said something that are you surprised? Are you disappointed? Is it interesting, if nothing else, to you? That are you doing the numbers that you thought you would do, or is it fewer?
It's fewer. We're ready for 2,000 a day. Through the next week, 10 days or more. We've got plenty of vaccine, and we've published through the LSU website what vaccines we're using when, and all those things. So we do have some outreach going on, and this today will be down in Mansfield. We expect a big turnout down there. A lot of folks have pre-registered, so that helps us know. And so we'd like to see more folks out, and I want to encourage folks to if they're working, I know it's more difficult, but talk to their employer about getting off a little bit early to come out, so that that they can get vaccinated before, because it's a win-win. If you're vaccinated, you're protecting yourself, and you're a good employee, not spreading virus to other people, and not missing work because of quarantine and other things. So we want to really encourage that.
Doc, you have some of the Johnson & Johnson vaccine available. When is that going to be administered, and how do people? Because some people say that's the only one they want. What's the procedure for that one?
Yeah, so we do have still a limited supply of Johnson & Johnson, and we're going to open on Saturday at the fairgrounds from 9 to 2, and I expect that we'll exhaust that supply on Saturday. We won't get more Johnson & Johnson vaccine probably till the 1st of April. So if somebody's really intent on that they can come on Saturday. But again, there's no guarantee. If we run out, we'll start using the other Pfizer or Moderna vaccines that we have available. But I want people to encourage people, get vaccinated. Don't be picky about which one. Get vaccinated. That's the most important thing.
For that Johnson & Johnson, do you need to pre-register for that one? I know you want them to pre-register for all of them, but is that a must for the Saturday event?
No, it's not. I mean, pre-register and indicate that you want. I mean, even on the registration form, there's not a place to say you want to come on Saturday. But if I've sent out a lot of time slots today and yesterday, and a few people email me back and say, I'll come Saturday for the Johnson & Johnson. You don't have to let me know. We've got a lot of flexibility. If just pre-register, that helps us. And then if you come on Saturday, that helps smooth us out by having you pre-registered.
Doc, just to clarify, once I'm in your website and registered, is that the only time? Is there an expiration date on my vaccination registration, but you've just got me forever and I don't have to worry about it again and I can do it at my convenience, so to speak?
Yeah, basically you can. I mean, your registration doesn't expire or anything, and even people who registered 2 months ago almost, I've emailed just in the past 48 hours to say, hey, now you're eligible or maybe eligible. And if you are, please come on out and get your vaccine. And so there's no expiration on your registration. You only have to register once. You don't have to do it twice.
Dr. White told us yesterday that there is still a population that are hesitant to get the vaccine. What do you say to those people today?
Well, I would say look around and see all the other folks who've gotten vaccine, who are doing fine. They're healthy. They're safe. And, folks are particularly concerned, I think, about what are potential long-term effects of the vaccine. And the most important long-term effect we know of is saving lives, protecting people from COVID-19 and shutting down this pandemic. Those are three really good long-term effects of this vaccine. Are there negative effects of the vaccine long-term? Not that we're aware of. We won't know until we know, but we have a lot of experience with these types of vaccines other than COVID, and we have no indication that there will be any long-term issues.